Hi, everyone. Thank you for attending today. My name is Ameri Arias. I am an admissions officer here at the Online Programs of Applied Learning at Johns Hopkins University Bloomberg School of Public Health. Today, we will be discussing our Masters of Applied Science in Patient Safety and Healthcare Quality.
Ameri, I didn't know if you wanted me to introduce myself. It's Albert Wu. I'm program director of the program.
Yes, thank you, Dr. Wu. So joining us today is Dr. Albert Wu, Director of the Patient Safety Program, like you just said, and myself, admissions officer here. I work with our team to assist students as they're exploring their options for continuing education. I'm excited to be presenting with you. You can introduce yourself, Dr. Wu.
I'll do it at a tiny bit more length. I'm an internist and a professor of health policy and management and medicine at Johns Hopkins, and I'm in charge of the Center for Meaningful Measures at the Armstrong Institute for Patient Quality and Safety. I am also the director of the Masters of Applied Science in Patient Safety and Healthcare Quality, which I think is the reason that many of you are logged on here. My own research deals quite a bit with patient safety. I'm particularly interested in how we handle errors and patient injuries, and that includes disclosing adverse events, reporting incidents and investigating them, and also dealing with healthcare workers who themselves are traumatized by incidents that happen in the hospital.
Thank you, Dr. Wu, for your introduction. To give everyone an idea of what we'll be covering today, Dr. Wu will give us an industry overview. We'll go over the program details, the curriculum, looking specifically into the curriculum, what you'll be gaining out of the program and the specific courses. This program is fully online, so he'll give you an insight of what it looks like to be in online learning here at Johns Hopkins University. Faculty will be highlighted. I'll go into admissions requirements, tuition and financial aid, details about the scholarship we offer. And if you have questions, please type them into the chat box. We will cover those at the end with Dr. Wu. Thank you so much for your time. And Dr. Wu, please feel free to start.
I will, but please jump in if I fail to say something, or if you think of something that really ought to be said, just hop in.
Okay, perfect. Thank you.
So this slide is titled Industry Overview, but I think it's more than that. I think that that patient safety is now recognized as being a worldwide problem. This is not a first world issue. In fact, the World Health Organization at the World Health Assembly this past May emphasized that patient safety is an integral part of healthcare, and as there is a worldwide push for universal health coverage, it's crucial that quality and safety be designed in from the very start. It's pretty obvious, however, that that is not already the case. My colleague Peter Pronovost, who you will hear in some of the lectures in our courses, and who was the founding director of the Armstrong Institute, said organizations profess patient safety as a top priority, but they are still figuring out how to manage it with the same rigor, discipline, and accountability that they do with their budgets. Many of you, perhaps the majority of you, are working in healthcare, and you know this to be true. Most organizations come pretty close to balancing their budgets at the end of the quarter or the end of the year, but we don't really have an equivalent accounting system for safety, at least most places. We do know that overall, in the U.S. and across the world, on average, 1 in 10 hospitalized people winds up being harmed while receiving care. In the U.S. alone, there are at least 1.5 million preventable adverse drug events every year. And again, in the U.S., the cost of those adverse events, not just drug events, but of misdiagnosis, unnecessary tests, and other things simply have to do with diagnosis, exceeds $100 billion a year. Just to focus on inaccurate diagnoses, we used to think that medication errors were perhaps the biggest problem. Well, it seems like inadequate diagnoses have emerged as perhaps the most common and costly of medical errors. This problem is only magnified in low and middle income countries. It may occur on average at twice the frequency that it does in developed countries. Because of this, organizations across the U.S. and across the world, hospitals, bigger healthcare organizations, ministries of health, are all hiring people to manage quality and safety. There are many job descriptions for that person, and the goal of our course is to provide a practical education to people who would like to be working on these problems, and to provide tools as well as frameworks and knowledge that can make it possible to do a good job in those positions. Next slide, please, maybe. So at this point, there is growing enthusiasm and an inherent commitment to patient safety and healthcare quality. Any frontline clinician is really aware a lot of the time about potential problems in quality and safety, and the same is true for managers. The problem is that in general, we are not taught patient safety in professional schools. It is only now beginning to become more of a regular feature in medical schools, and perhaps in nursing schools, in pharmacy school. The real challenge is that we generally lack expertise, training, and actually even the scientific foundations in areas that are related to quality and safety. And some of those are knowledge-based, but others have to do with designing projects to improve safety, analyzing data, measuring safety and quality. All of these things are necessary to be a real leader in this field. Certainly, the concepts related to patient safety and quality are appealing, and they really apply to all sorts of healthcare professionals. We've recently seen quite a few job titles that have safety in them: Director of Quality Management and Patient Safety, Medical Director and Patient Safety Officer, Nurse Director of Clinical Quality Improvement. In fact, many hospital patient safety directors are nurses. Director of Risk and Quality Improvement, Director or Vice President of Quality Management, Director or Vice President of Patient Outcomes, Quality Assurance, Patient Safety, Performance Improvement, or Patient Safety Officer or Patient Safety Consultant. These are job descriptions that are out there, and some of you are already in those roles. I talked to someone yesterday, however, who said that he was, in fact, in one of these positions, but he confessed that he didn't have enough didactic knowledge and wasn't aware of all of the things that he could be doing and really needed to be skilled up a little bit. Next, please. So this program is a full-fledged master's degree in the School of Public Health, the Bloomberg School of Public Health at Johns Hopkins, which is by most estimates the #1 public health school in the world. It is, however, a very skills-based program, and this differs a little bit from some of our other programs, which may be a little bit more theoretical. Well, this is intended to be practical. It's aimed at working professionals. It's designed to be part-time, and even though we love to see people come to campus, it is 100% online. Because if you are working a job, can you really come to Baltimore to take our courses? It requires a total of 48 credits, but that is on average spread over 2 academic years. We have quarters here, so that is 4 terms per year. In general, you take 2 courses per quarter. Besides the courses, there's some professional development activities, and there's an integrative activity which you do in the 4th year to try to pull things together. We've gotten pretty good at this. I think we're a real leader in online education. There are over 100 courses in the School of Public Health alone that are taught online these days. And I think we try to keep up to date. There's a lot of group learning, peer assessments. I think that people find that the material is delivered in a dynamic and interesting way. And we're very interested in you acquiring skills. There are lots of projects, many examples or cases, and opportunities for hands-on learning. This is a public health degree. It's not a management degree. We're really interested in health, and the goal is to educate students on measuring safety and quality, designing safer systems, on accomplishing organization and cultural change, on patient-centered, or I should say perhaps person-centered care, and on preventing harm, and then equipping students with the tools to accomplish those goals. Next, please. So here's the curriculum. Again, this is a public health degree. This is fully accredited by the public health accreditors in the U.S. And so here's on average what people do in year 1 and year 2 of the curriculum. There's sort of a little bit of a pre-course on how to sort of complete online learning. But then every term you take 2 courses, essentially. In the first term of year 1, and we're just finishing that now, there's a short ethics course, but then there is a core course, an intro to quality of care for practitioners, and a seminars in public health course, which fulfills a distribution requirement. Second term, and we've just started today, a core course is the science of patient safety and case studies in quality and safety from both high income and some low income settings. The third term, you really need to know some biostats and some epi in order to be able to do a good job. So there's an introduction to epidemiology and a professional development course on writing for results. And any of you who are in this business realize that part of what you need to do is write persuasively. In the fourth term, statistical concepts from public health, there's a little bit of that biostat. Some people find this a little bit challenging, but it's certainly better to get it done by people who are really great at teaching biostat. And I would say that that is definitely true for our instructors. This course has been designed expressly for an online course. And then Leadership for Change and Patient Safety, which is really a fun course. I think that it is crystal clear today that you can't develop patient safety strictly from the bottom up. You need leadership support, encouragement, and endorsements for it to work. In year 2, you again take some statistics and then a course on quality improvement tools. One of them might be root cause analysis, or another might be team training. Second term, a second course on epidemiology, and a tailored advanced topic seminars in public health. In the third term, measurement and evaluation in quality and safety. Almost everything seems to be about metrics these days, and this is taught by Jill Marsteller, who's one of our experts in evaluation and measurement, and a course which we only teach in this degree and not taught anywhere else in the School of Public Health, infection prevention in healthcare settings. Finally, in the fourth term, we have an integrative activity. You've actually started to do this a little bit as early as the first or second term in year 2, and a measurement lab following up on that measurement and evaluation course on quality and safety. So hands-on experience in actually doing the things that we're telling you you ought to be able to do. Now, it is possible for some people who find themselves very busy to spread this out. This curriculum can be spread out into 3 years, and some people are even taking it over 4 years. So there is really the possibility to customize the experience. Next, please. So we're really happy with this course, I will say. It is, Johns Hopkins has been a real leader in patient safety and quality since the turn of the century, turn of the millennium. But the program is a real collaboration between the 3 major professional schools in Johns Hopkins, the Bloomberg School of Public Health, but also the Johns Hopkins School of Medicine and the School of Nursing. There are instructors and course leaders from all of those schools. The course is really led by many of the people who run patient safety at Johns Hopkins. Many of them are world-renowned experts who are today shaping the field through their research and practical applications. And we really believe in using research to inform operations, to inform practice. And this is a philosophy that we hope to transfer to you. We've been teaching online courses for more than 20 years. I've been teaching an online patient safety course myself since about 2006, one of our first online courses ever, and this is a perennial favorite here. We among our own students who are on campus, there are probably at least 100 students every year. The courses are developed, as you'll see if you enroll, with really high production values. The activities are engaging. I think it's fun. It's attractive, and I think it competes well with the other activities that you could possibly be pursuing. I think it even competes well with some of the other video programming that you might consume on your sofa. The faculty have recorded all the lectures ahead of time, so you can binge watch lectures. You can sample them as you go. You can go back and view them again. And there is a help desk that's available 24/7, no matter where you are around the globe. Next, please. So I've been leading this program since its start. We are now just starting our 3rd year, and we had our very first graduation. In our first class, we enrolled almost 50 students. This was a little surprise. We weren't anticipating quite so many students. And we graduated about 35 of those people. Some have decided to stretch things out over a longer period of time. But of those 35, I think something like 27 of those people showed up on campus for graduation. This was a shock to us. People flew in, one woman from Kenya, another from Nigeria, a gentleman from Liberia, people from Canada, and a surgeon from Australia. They all wanted to be here, and they all wanted to see each other face to face because they'd had such a positive experience and really, surprisingly perhaps, got to know each other online over the couple of years that they'd taken the course. I can mention just a few of our faculty members. Matt Austin is one of the leaders in measurement of quality and safety in the U.S. He, besides working with Hopkins, he works closely with U.S. News and World Reports and with the Leapfrog Group. Renee Dembski is in charge of safety operations for Johns Hopkins Medicine. Cheryl Himmelfarb is a nurse, researcher, and leader in patient safety. Sydney D is a world authority on quality of healthcare. Lisa Maragakis runs our infection control program and is lead hospital epidemiologist for Johns Hopkins Hospital. And one of her effector arms, one of the most, the best educators I know is Melanie Curlis, who is a infection control nurse. Jill Marsteller is a leader in evaluation and is in fact in charge of evaluation for the Armstrong Institute and the coordinator for research at the Armstrong Institute. John McGreedy is an unbelievable statistician who's won many awards for teaching of biostatistics. He can convince you that while you're listening to him, that you actually get it. And then you can go back and review again until you really do. Laura Morlock is our Senior Associate Dean in the School of Public Health and has been doing work on risk management for most of her career also. She led our management program in health policy for many years. Lori Payne is a nurse who's the Director of Patient Safety at Johns Hopkins Hospital. Peter Pronovost, whose name you may be familiar, is one of the world's leading authorities on patient safety. It was he who really brought us checklists and how they can be used practically in healthcare. Mike Rosen developed the Team Steps program, which is probably one of the most widely used team training programs in the world. Melinda Sawyer developed the Comprehensive Unit-Based Safety Program, or CUSP. Kathy Sutcliffe was the inventor of high reliability theory for organizations, how we can do things better and more safely. So this is really an incredible faculty. I didn't even mention everyone, but all of these people are the people who are lecturing to you and teaching you during the year. Next, please. So would you want to talk a little bit about some of these requirements?
Yes, of course. Thank you, Dr. Wu, for this insight into the patient safety program. I'll take it from here. For those of you that may have joined us a little bit after the presentation start, please make sure you type in your questions in the chat box for the Q&A at the end. I'm going to take some time to go over the admissions requirements, so if you're interested in moving forward, it is important to know what you need to know about the admissions process. All of our applications are processed online through SOFIS to streamline your application process. The requirements for education is a bachelor's degree from a regionally accredited college or university. The professional requirement is a minimum of 3 years of work experience in the health-related field. A clinical background is not required. We do require a current resume or CV to be uploaded into the online portal, highlighting previous healthcare accomplishments. You will need 3 letters of recommendation. The statement of purpose is a big part of your application process. This is where you will be able to communicate to the admissions committee why this program, how this program matches up with your career goals and the educational objectives you are trying to fulfill, and how you hope to apply it to your career and in your future. For our international students, if English is not your first language, you may need an English proficiency exam. We accept either the TOEFL or the IELTS. For those of you who have obtained education outside of the U.S. for academic records, it is a requirement that you undergo a course-by-course credential evaluation via the World Education Services. As you can see, we've shortened it out on this slide for WES, WES, which stands for World Education Services. Looking over the admissions information, our applications are reviewed on a rolling basis. Our application is currently open now for the fall of 2020 to start on August 31st of 2020. Meaning ongoing rolling basis, meaning that you don't need to wait until the deadline's posted on the slide to hear back from the admissions committee with your decision. We encourage students to apply early so you can receive your decision early. Applications are now open for a priority deadline of April 15th with a final deadline of June 1st. We are here to assist you through the application, so if you have any questions or concerns on the application, you have a support system with us. We only enroll one time per year, so it is important that if you are excited about the program, we only have one start a year. So right now it's open for the start of August 31st, 2020. If you're interested in starting but don't want to fully commit to a full course load, you do have the flexibility of starting one class at a time. To provide insight on the investment of school, right here is listed all of our financial information as well as some information about our financial aid office for those who are eligible and utilize other financial resources such as FAFSA or private loan information. You can feel free to look at our website or email or call them. The information is listed here. For the 2019-2020 school year, the tuition is $1,162 per credit. We offer an OPAL scholarship that is available for these programs, is a partial OPAL scholarship that covers $446 per credit, which leaves the students responsible for the remaining $716 per credit. This scholarship is specific funding to our OPAL programs, which is our online programs of applied learning. If you are admitted into the program, you automatically are awarded the OPAL scholarship. There is nothing additional that you need to do to receive it. If you are planning financially, we want you to plan for the $716 per credit at the current tuition rate. Of course, keeping in mind our tuition rate and scholarships are reassessed each spring. Any changes will be updated on the website in late spring. So just to go over the credit breakdown, it is 40.5 credits at $716 per credit. And now we have time for the Q&A session. If you have any questions, please feel free to type them into the Q&A chat box. We do have some questions coming in already. Dr. Wu, I understand that the time commitment is 18 to 20 hours per the two courses. Could you elaborate a little bit more on what that looks like?
Yeah, I mean, it's like most most courses, there is the amount of contact time is probably doubled by the amount of time that you might spend outside of sort of actually viewing a lecture. So there really are, for any given course, there might be a couple of lectures per week that you would need to view. But beyond that, though, a lot of the work is homework or reading and or things that are outside of class. I don't know if that's helpful.
Thank you. Another question we have is, can you provide some examples of the integrative activity?
Yeah, so basically people are invited to take a problem that they are interested in or they might even be confronting at work. And what we're hoping that people will do is take what they've learned about thinking about safety or quality, measuring it, coming up with some way to improve safety perhaps, and then evaluating how that is done. So if you're confronted with a problem that you would like to work on, you can essentially work on that project as your integrative activity. Other people might do something that is sort of a little less directly hands-on. They might want to get a better handle on what the state of knowledge is or what tools are available to investigate problems or how people are handling some or other issue related to safety or quality. So some people might just do a systematic review or even a less than fully systematic review of a topic so that they know more and can be more authoritative about it, for instance. Some people also write some people use the time to write proposals. If they might be an internal proposal or an external proposal where someone has an idea that they want to write essentially a grant about, and that's something that some people have done too.
Perfect. Is it possible to double up on a course and complete the program in 1 year?
Currently, it is not possible because there's some sequence in courses, and so it's not possible to. You need prereqs in order to take some of the subsequent courses.
Does the diploma at the end, when you graduate, say anything about an online program, or does it just show Johns Hopkins University Bloomberg School of Public Health?
That's what it says. It says Masters of Applied Science in Patient Safety and Healthcare Quality, Johns Hopkins.
Perfect, thank you. Is the program suitable for lawyers, and what type of roles could a lawyer pursue after graduating from this program?
Yes, so in fact, we have had lawyers take the course. A big chunk of patient safety is, I edit a journal, which is the Journal of Patient Safety and Risk Management. In fact, some of my best colleagues are lawyers who are interested in risk and risk reduction. So I think that there is definitely a pathway for lawyers. And I think that if you could get through law school, I think you can certainly get through this curriculum. You may grit your teeth to get through some of the math, but it's definitely doable. And I think it provides a good background to help someone who's interested in that field, that is to say risk management, sort of understand more of the medical side of things.
Perfect. Is there a thesis in this curriculum for the Masters of Applied Science?
At integrating activities, so it's not a thesis per se, but you're required to hand in something.
Hey, I have a student. I'm a safety professional who doesn't work in the medical setting, but I want to transition to a hospital setting. Do you think that it would be possible without a prior medical background?
I think it's possible. I think that, at some point or other, some face-to-face, hands-on, work in a health setting would really be necessary. But this could provide you with sort of the knowledge and some of the tools that are necessary. I think that this would put you in a better position. But I think that you would really have to go and do something that's a little bit less theoretical, directly with at least some kind of patient contact.
Perfect, thank you. How many students do you accept in the program?
We accept as many students as are qualified. So in the second year of our existence, I think we accepted 103 students.
Perfect. What are the networking opportunities available to students that get accepted into the program?
Oh, I think there's a lot of opportunities. One is that you automatically have a network of really a couple of hundred students who are currently enrolled. The second thing is that there are, as far as sort of the university goes, at least electronically, there are every year there are 1,000 students who are graduated from the School of Public Health. And last year it wasn't 1,000, but it was about, I think it was 906 master's and PhD students in the School of Public Health. So potentially there's that network. In addition, everyone is issued an advisor who is from our faculty, and those advisors can connect you. So if you have a particular interest, they can help hook you up with the kinds of people that you might be interested in being in contact with.
Perfect. I do have a question here that is there more of an emphasis on patient safety, on quality improvement, or an equal emphasis on both?
I think that this is not this is not all just quality improvement for sure. I think it might be, I don't know, maybe it's 60-40, and it's not just quality improvement, but a lot of what we're interested in is quality assessment first, quality measurement, as well as quality improvement.
Perfect, thank you. The resources that students have when they have questions on assignments, how can they gain support through classes? Are there TAs, faculty contact?
So, great question. First of all, every course has 3 or 4 TAs. So, and those are all graduate students at Johns Hopkins who are interested in this topic. So they've all taken related courses, and I think are pretty able to field sort of at very least the first line of questions. Everyone is assigned a faculty advisor, and so those people are people who are working full time in patient safety at Johns Hopkins. And then the project directors, myself, and to a little bit lesser extent, Dr. Morlock, are certainly always available to field questions.
Thank you. Do students learn concepts in this program that would be applicable on the civic or statewide level?
Well, this is a school of public health, so I think many of the principles are aimed at not exclusively at one person at a time health, but at public health. So I would say yes. And we are, the program does run out of, the primary home for this program is a Department of Health Policy and Management. So again, there is a little bit of a policy focus that we'd like to keep on topics.
Are there required internships or internship opportunities available within this program?
There's no required internship. It is potentially possible to set something up, but there's nothing that is explicitly part of this program.
Thank you. Has anyone ever completed their integrative activity on a topic of dysfunction among doctors or other hospital staff?
Yeah. I think that I can think of one project that was on that topic. I personally have a real interest in impaired practitioners. So I think that we are aware that even though in general individuals are not to blame for problems in healthcare, with some exceptions, those individuals are parts of systems that sometimes don't work so well. Individuals are an important part of the system.
Perfect, thank you. With the demand for patient safety, how does someone go about finding a job?
I don't have a very quick answer, but in fact there are postings in many places for just about every large healthcare organization and health department in the US anyway has positions in quality and safety. They're even looking at postings at our hospital. Every month there's things that are posted.
Perfect, thank you. How would you compare this program to others that are available? So why would someone pick this program over the other patient safety programs that are out there?
Yeah, that's a good question. So first of all, I think that it is, I think that it's safe to say that Johns Hopkins patient safety is one of the world's leading programs in patient safety. It's probably, I was talking to a colleague at Harvard the other day, and he said, I think the Armstrong Institute is probably the number one, academically based patient safety entity, in the U.S. and in the world. Patient safety is very integrated throughout our health system. So we have people who are very operational, who are teaching this course. We have our hospital director of patient safety, and we have our operations director for patient safety, who are lecturing and running some of the courses, and that's an unusual opportunity. I think that we do have a focus which is not exclusively clinical, and it's not exclusively medical. It includes nursing and medicine and public health, and for that matter, sort of a lot of, perhaps you might say, consciousness of social influences on health. So I think that that's an advantage. It's entirely online, which I think is an advantage. However, if you have a couple of years in which you wanted to do a patient safety training in sort of face-to-face, then this is not the right program. Our advantage of being entirely online is an advantage if you want to do a 2-year fellowship on site somewhere. And if that's what you're interested in doing, there's a program at Harvard that I think is terrific. On the other hand, they only take a couple of people a year. And last year we took, 80 or 100. We also have a real critical mass of people. I think that we're anticipating enrolling, sort of close to that number of people every year for the foreseeable future. And that's a great network. I witnessed the fact that people in the course make really good friends with each other, and I think that that's something which is important. So those are just a few of the advantages. As you can tell, I think we're pretty good.
Yeah, I think so too, of course. So the GRE requirement, is there a GRE requirement? I can answer that question. There is no GRE requirement, but the admissions committee will be looking at everything in your file with your transcripts and your grades, of course. How would this program help pharmacists either in the pharmaceutical field or transitioning into a new role? Dr. Wu.
Yeah, medication safety, many people think is the biggest single safety problem, that is out there. The World Health Organization has medication without harm as their third global patient safety challenge. I actually personally was on the Institute of Medicine committee on preventing medication errors. So this is a topic that is close to my heart and our heart. There are also people with pharmacy credentials who are teaching these courses. And if we ignore medication errors, we won't get safer care.
Okay, perfect. Is there an emphasis on changing public policy within this program?
Not so directly, but you would see that we have our eye on generating evidence that is policy relevant. The main focus really is more practical and equipping people with tools. However, if you're interested in that, there are a ton of people who you could team up with potentially who have, again, I sit personally in a Department of Health Policy and Management, and that is the major focus of a lot of folks.
Perfect, thank you. What is the admissions committee looking for, with the experience? Could you elaborate a little bit more?
Yeah, I think that what the admissions committee is really looking for are people who are currently or who currently could use education and training in safety and quality, or in the future, this could really be helpful to them in their careers. So some people who we apply are people who are doing this already from day to day. On the other hand, other people are people who are interested in moving into this field and need something to help them get started. So both of those people are equally appropriate, I think, for the program. I think our main interest is that what we're mostly looking for is a person that this program could help.
Perfect. Could you provide some more details on how this program would benefit a non-clinical professional who may not want to be involved in the clinical setting?
Well, so I mean, I think that if you are, it depends on how uninvolved you would like to be. I think that understanding sort of safety science, understanding, quality measurements, learning about sort of epidemiology and learning about biostatistics, all of those things are fairly fundamental and are potentially transferable to other kinds of problems. So if you learn about high reliability theory, or if you learn about teamwork, in fact, those things might serve you well in areas that are not strictly clinical. We do focus a fair bit on sort of clinical environments. They could be hospitals, or they could be ambulatory settings, or they could be essentially things that are more related to public health. I don't know if that's the answer that you're looking for, but I think a lot of this is at least some of this is basic science, really, or practical basic science.
Perfect, thank you. As far as the healthcare accomplishments, on the resume or CV, what are you looking for in that with the admissions committee?
I think that again we have people who are who are fully engaged in healthcare jobs and even working in quality and safety. I think we have other people who are at a much earlier stage in their career, and I think that there's no sort of cookbook there's no checklist that we have that says you must have done this, that, or the other thing. I think that if you can explain why this is relevant to you and what experience you have that leads you that supports that belief, I think that's good enough.
Thank you. One other question, what platform do we use? We use Course Plus. I don't know if you want to elaborate a little bit more on the platform setting, Dr. Wu.
Yeah, this is actually the online learning platform that we use for all of our 100+ online offerings at Johns Hopkins in the School of Public Health. It's actually run by a big and growing group of people who do exclusively online education. I think that people are find that in general it's pretty friendly. It's pretty easy to use. It's possible to embed lots of things into it, including sort of live team activities. But it's a customized platform. It's not it's not an off-the-shelf platform.
Perfect, thank you. We do have a couple minutes left, so if you have any last-minute questions, please feel free to type them into the chat box. Another question would be application fee. Once you submit your application, it is $135 with SOFIS for this master's program. We do encourage you to apply early to get your decision early. Another question for you, Dr. Wu. Would this program be based on the American model system or more globally focused?
So it is, I would say that much of what we do is American focused, but we deliberately have elements that are globally focused and including those that feature low or middle income settings.
Perfect, thank you. Are exams proctored?
The exams are the exams are all online, it'd be a little hard to proctor them, really.
Okay, perfect. Are there certain times when you log in for an exam, or
I'm sorry, say again?
days? Are there specific times that they would have to log in for an exam or quiz? Are there specific days? It might vary per professor, but
it's
could
pretty
you elaborate on
variable. In general, a lot of the assignments wind up being papers more than quizzes. But there are not so many timed activities.
Thank you for your time, Dr. Wu, on those questions. I thank you all for attending. If we didn't get to your questions, we will be connecting with you offline. Our team at the admissions office will contact you directly in the next few days to assist you in answering those questions. If you want to connect with someone immediately, my contact information is on the slide here. Feel free to reach out via email or directly call me. If you are excited about this presentation and see this as part of your future, please feel free to use a scan code here to move forward with your application. I hope you are ready to move forward and apply. We have a dedicated admissions team who is looking forward to working with you throughout the application process. Thank you, Dr. Wu, and thank you all for joining us. I hope we talk to you soon.
It's my pleasure. Thanks for tuning in.
Thank you.
Take care.